Family Nurse Practitioner Scope of Practice and Role Delineation. Scope of Practice Statement. The Scope of Practice Statement is an important component of professional regulations applied by most of the nurse practitioner licensing boards in the United States. It defines nurse practitioners' procedures, processes, and actions applicable to their professional licensure. By definition, the Scope of Practice Statement for Family Nurse Practitioners, FNPs, seems to be broad because FNPs are involved in caring for various patients and sectors. The range of patients starts from pediatrics to geriatrics, while sectors range from public to private hospitals for both urban and rural areas. The scope of practice for FNPs is demonstrated below. Professional role. As a family nurse practitioner, I fit in almost all healthcare settings, such as hospitals, clinics, nursing homes, learning institutions, and home health. I get involved in assessing, diagnosing, coordinating care, educating, and counseling patients and families. As an independent FNP and licensed, nursing practice is autonomous to me to allow cooperation with patients and other healthcare professionals. I provide several services, such as diagnosis and management of different health problems, and serve as a patient advocate, interdisciplinary consultant, and medical researcher. Besides, my role as an FNP is consistent with the framework and context of the APRN model practiced in the family foci, which is based on the patient's needs. Education. Based on the education spectrum, I am an advanced practice registered nurse, graduated with a master's degree, and have obtained national board certification to offer my services as a family nurse practitioner. From my educational background, I have attained APRN core, population core, and serving role competencies. During my graduate education, I acquired specialized knowledge and clinical practice competencies to propel me to practice in the spectrum of healthcare settings. After accreditation as a nurse, I have satisfied all professional regulations as established by the nurse practitioner licensing boards that have equipped me to provide safe, cost-effective, and quality care. Accountability. I have vast experience in family nursing, which means that I am accountable to the nursing profession, patients, and licensing boards. My family nursing practice has been consistent with an ethical code of conduct, practice standards and protocols, evidence-based practices, and national board certification. Indeed, clinical practice competency is attainable with the highest level of accountability to patients and other stakeholders in healthcare. Responsibility. Patient-centered care is one of the greatest roles of family nurse practitioners, which should be accompanied by the commitment to satisfy dynamic societal needs and changes in the healthcare system. As a family nurse practitioner, I have to be responsible to people and ready to adapt to evolving healthcare needs. As a nurse, I have to play a critical role in providing, mentoring, educating, researching, advocating, and administering. I have to take part in professional development, participate in professional groups, and participate in health policy development starting from local to international level. Generally, I have to provide patient-centered care that is cost-effective, high-quality, and safe. Role delineation for family nurse practitioner. The role delineation is critical in allowing the public to know how family nurse practitioners will accomplish specific competencies outlined by the National Organization of Nurse Practitioner Faculty, NONPF, and the AACN. The NONPF and AACN have stated the list of role delineations based on FNP competencies to ensure patient-centered care is cost-effective, high-quality, and safe. Performing most of these roles in nursing practice, they are significant for an individual to become a successful FNP. As an FNP, I have to execute each of the roles listed by the NONPF and AACN to comply with the responsibilities delegated to nurses by the National Council of State Boards of Nursing, NCSBN, which include delivery of primary care in hospitals, learning institutions, and other registered clinics. While executing these roles, I have to apply my knowledge and methodology taught from different programs, plus my professional experience to perform this role as stated below. NP-patient relationship. It is essential to establish a relationship with patients to influence better patient care. As an FNP, I have to establish trust and develop a relationship with patients and their families. I will have to avidly listen to the needs and concerns of my patients. I have excellent communication skills that will enable me to communicate effectively with my patients to consider their values and needs, which are always dynamic. Effective communication will make me persuade patients to avoid resisting the treatment options suggested to them, maybe due to fear or ignorance. I will ensure that my patients adhere to medication, restrictions, and follow-up required for controlling symptoms and improving health. It will assist in establishing a strong relationship with patients to aid in ensuring strict adherence to treatment protocols and procedures to enhance treatment outcomes.